Okay, thank you so much everyone for joining us today. We are pleased to present to you schedule a webinar about how to simplify operations for coordinated home health care. First, just a few quick housekeeping measures. If you have any questions, please type them in the Q&A panel in your webinar portal. And any questions that we don't get to today, we will follow up with you via email. And the webinar is being recorded, so don't worry if there's a detail that you missed or something you want to go back to. We will send you the recording so that you can have all that information at your convenience. And my name is Marie Francis. I'm the Senior Director of Product Marketing here at Schedulo, and I'm really pleased to introduce our customer, Greg Pino, who is the VP of Operations and Sales at New Jersey Respiratory Associates, or NJRA, which is a family-owned and operated business that has been serving skilled nursing facilities in New Jersey for over 30 years. And under Greg's leadership, they have seen 20 to 30% year-over-year growth for 3 years now, and just hit a milestone for their business of 150 customers, which makes them bigger than they've ever been in their history. So today, Greg is going to share with us how this home healthcare company was able to achieve such extraordinary growth in a very challenging marketplace. And so thank you so much for being with us today, Greg. We're really excited to hear from you. And just very quickly, what we're going to go over today is first, Greg and I will kind of share our point of view on the home healthcare landscape and the challenges that this landscape is putting in front of home care providers. And then Greg's going to go on a deep dive into how New Jersey Respiratory Associates has managed to these challenges and been able to achieve such fantastic growth in the process. And then we'll talk a little bit about what healthcare IT leaders can do, and we're going to get advice straight from Greg on that. And then I'll just really briefly go over the Schedulo for Healthcare solution, then we'll take any questions. So let's dive right in. First, let's talk about what's going on with the home healthcare industry in the U.S. And this is really a story of changing demographics. And more, I would say, almost more than any other industry in the U.S., the changing demographics of the country are really having an impact on this business. Because what we're seeing is a story of an aging population and aging talent. And simultaneously, as the population is aging, you have a talent pool that is aging, and people are starting to look closer, be closer to retirement age than entry to the market age. We're seeing a dramatic increase in demand for their services. So that's going to put a really serious, simply a supply-demand constraint on home healthcare providers. Home healthcare providers are going to have to ask themselves really tough questions about how can they make their business more efficient, how can they retain the talent that they have, and how can they make sure that they're able to not just meet patient needs, but actually grow in this constrained talent environment. And simultaneously, as those demographics are changing, we're also seeing a change in patient preferences and attitudes. As the industry has grown, there's been an increased focus, and rightly so, on quality of care delivered. But what is quality care, and what does that mean to providers versus patients? On the patient side, one of the strongest indicators of quality care to them is actually not necessarily a health outcome. It's really rooted in how they feel their relationship is with their providers. Do they feel that those people are looking out for them? Do they understand their concerns? Are they being empathetic to their pain and challenges? That's really the most important thing that patients care about, and the way they define that quality relationship. And simultaneously, we're also seeing bigger market forces impact this industry as well. And it's the same type of changing expectations that every industry is being hit with, and that's the consumerization of services, whether those are B2B or B2C services. Everyone, just about every consumer now knows what a top quality or nearly flawless customer experience looks like. The bar is being set extremely high by companies like Amazon, Netflix, Postmates, Lyft, on-demand services, and businesses that have really nailed it when it comes to giving people precisely what they want in the moment that they need it. And as I said, no industry is immune to these expectations. We've worked with a lot of our healthcare customers very closely and asked them what they think about this topic. And one thing that we've heard is even though they might be serving more elderly patients, who might not necessarily be as tech savvy. You know, they aren't the ones setting up their Netflix accounts or ordering through Postmates, but their children and their grandchildren are. And so the expectations of these younger family members and caregivers are actually bleeding through even if the patient isn't the one driving that expectation, because as we all know, being a caregiver is something that eventually most of us end up being at some point in our life for somebody. And you know, especially with senior patients, you're usually dealing with a team of people or a family of people who are looking out for their loved one. So Greg, I was wondering if you shared with something really interesting with us the other day about how much you guys are seeing this, not just on the patient expectation side, but among your caregivers as well. I'd love to hear more about that.
Yeah, I mean, you know, from our perspective, obviously, you know, when we go into a center, we have two sets of customers. We have both the caregivers and the patients. And on the other side, we have our employees that also have their own expectations, given, you know, the different places they can work. And if we're not delivering them a way to do their job efficiently and effectively and without frustration, it's going to be really hard to retain them. And that's something Schedulo has enabled us to do.
Perfect. Thank you so much, Greg. So, you know, we're definitely seeing these changing demographics start to squeeze the talent pool. We're seeing expectations both on the patient and the caregiver side translate into higher expectations for the way businesses operate. And ultimately, what happens is these challenges can be stagnating to growth, even in a very fast-growing industry. When we start working with healthcare providers, especially home health care, we usually kind of go through a series of questions trying to gauge what some key performance indicators and health of their business is looking like. Everything from, you know, how are you actually using your workforce, what's their capacity, and are they actually able to not only meet with lots of patients, but really feel productive in the course of their day? How is that translating to patient satisfaction? Do patients feel like you're being responsive to their needs? Are you asking your patients to operate around your business's needs and your business's timetable, or are you prioritizing their needs and their preferences as you deliver care to them, whether it's at home or like NJRA in a nursing facility? You know, as we were just discussing, this caregiver retention issue is going to be one of the biggest challenges that the home healthcare industry is going to face for years to come. How are you preparing for that? Are you already seeing challenges around there? And what we often find is that you can see some of these problems manifest both in processes in the back office and, you know, really at the bottom line, both in terms of how claims are handled, how billing is handled, and then really ultimately what your growth prospects are. And so this is kind of a overview. Not looking to be bleak in any ways. Home healthcare is obviously a vibrant industry that's growing really fast. And what we are interested in doing is helping these businesses really capitalize on the increased demand that we know is coming and that's already starting to manifest. And really excited to hear from Greg today because, as he said, you know, this is a 30-year-old family-owned and operated business that has just achieved extraordinary growth in the last several years. So, Greg, I'll hand it over to you, and we're excited to hear the NJRA story.
Thank you very much, Marie. So I'll kind of jump right in here with kind of a background of who we are and how we started. We were founded about 35 years ago as a clinical respiratory company to service settings outside of the hospital. And since then, those settings have really changed. And specifically looking at nursing home settings, you've seen a higher acuity patients come into these settings and then need to find ways to care for them. And that's what we help them do. We provide them with on-demand respiratory therapy for any of their new admissions or ongoing patients that need help and care. Today, we're currently servicing 150 nursing facilities around the state of New Jersey. It's the most facilities we've ever had, and it's really kind of been able to grow that way by help of Schedulo and Salesforce and the ability to give us our ability to scale these on-demand services. Today, we've grown beyond just clinical services, and we do DME, so medical equipment, supplies, education, and different stuff like that that helps complement that clinical program. So that's a little bit about who we are and kind of where we came from. When I came on about 10 years ago, we were a much smaller family-owned operation than we are today. And our biggest challenge was how do we scale the high-quality, high-touch respiratory care that we were currently providing in a way that would enable us to replicate it across more facilities. And we looked at a couple different things. We have a mobile workforce that are going around to 5 to 8 buildings a day, some of which they know at the beginning of the day, some of which they don't, that come in as we get called. That ability to meet the on-demand needs, so the ability to be at a facility within 2 hours of them calling us, and having the support to bring that on. The other part was billing, which is always difficult for this type of service. So normally we send our bills out at the end of each month. So kind of figuring out what's going on at the facilities a month or a week or two after it's happened as we're billing it and all those questions, we have to kind of reconcile at the end of the month, and we were looking for a way to do that kind of in real time. And then kind of getting away from using Excel and different, kind of email and texting and kind of figuring out like a single way to bring all of this information together. Salesforce in combination with Schedule really gave us that ability, and kind of to kind of focus in a little more on that. We have two types of field workers. So we have our respiratory therapists who are doing clinical work, and we have technicians. When each of them has a job, what's interesting about our model is one job can consist of different sub-jobs. So we actually built out a custom form that our clinical workers fill out and also our equipment technicians fill out. And these forms are almost like miniaturized electronic health records. So when our therapists go into a job, they open up their form and they see all the patients they have to visit during that job and are able to quickly kind of fill out what they do for those patients. That information gets sent over to our administrators in the office for reconciliation. So any questions that we have on what they're doing, we can answer the same day, as opposed to in the past when we kind of got that bill at the end of the month and then billed from there. They really didn't remember any questions that we had of events that took place earlier in the month. Once we got the respiratory therapists onboarded onto our system, we really wanted to also onboard our equipment technicians. These are the guys who are delivering equipment and supplies. So now every time they go into a building, whether there's one patient or a couple patients to deliver things to, they open up their application, they open up their custom form, and they see what machines are on each patient and what to take back and what to leave and different things like that. And again, that information is then sent into the office in real time to be reconciled, and any questions that we have, we can ask right away. In the past, what we were doing is they would come back with their physical tickets, and we'd have to kind of translate that into the invoice and into our tracking system. In addition to just kind of having the application open, we're also, the scheduling of everything has changed dramatically. So in the past, for our clinical services, we would schedule things out on a weekly basis, and then as they come in during the week. With Scheduler, we've been now able to put schedules out for 6 months, and then have automatic changes take place during the day as new things come in, and as patients leave. So one example of that is, we might have a patient at a facility who needs to be seen once a week. And we'll schedule that once a week visit out for 6 months. If that patient then leaves, and we discharge them off of our system, those jobs are then automatically canceled for the future. So there's some automation that's built into this that enables us to have schedules out that often. Another example is if we get an on-demand patient in during the day, a notice will come up saying, okay, when's the next time a therapist is going there? So if we have to route that therapist there today, but there's a job on for tomorrow, we know that it's more efficient to move that job to today so we don't have to send them tomorrow, and that therefore opens up their time for tomorrow for new admissions that might come in. So kind of the logic-based scheduling and dispatch has really picked up, and it was a pretty seamless process to do that. And then kind of just talking about how everything's been centralized, and that obviously involves Salesforce, and switching over to Salesforce was a real game changer for us. But as you kind of see what Salesforce is capable of, Schedule has really kind of integrated into that in a way that really makes it easy for us to manage our field service operations. And then the other thing is offline. As you're going into either homes or these facilities, the internet isn't always the best. So being able to access this information while offline and then it automatically sync once they come back online has really helped us out in not having to rely on Wi-Fi networks and different things like that. So some of the results that we've seen, we've been able to increase the amount of accounts our therapists cover by almost 33%. And that's really a result of the logic-based scheduling. So knowing that, okay, we get called to a facility today, but they're already going tomorrow and opening up their time for tomorrow, so they're not going to 2 facilities 2 days in a row if they don't have to. Our equipment technicians are able to go in and out of facilities a lot faster because they know exactly who has what machines, what those settings are, what they're picking up, and how to record it, and they don't have to write and document each ticket every time they do it. We've seen greater than 20% growth for 3 years in a row now because of this ability to scale, which for a 35-year-old business is pretty great. And we don't see any signs of slowing down. And as Marie pointed out, the clinical needs for these patients, both in-home and in these nursing facilities, is only going to grow as the push to not have to send patients to the hospital increases. So we definitely see a big growth in both the home care and nursing home market. Having one system that does everything has also been a great result. So it's not like we log into our email and Salesforce and Excel and our accounting system. Now it's really just Salesforce. And having all of our cases and everything come into Salesforce has really enabled us to become a lot more efficient on the administrative side of things. Whereas we would have in the past maybe needed 5 to 6 people in the office kind of reconciling everything, we really only have 2 for 150 buildings, which is pretty incredible. And finally, we're further progressing the integration into our accounting system now. So only like 2 months ago, we were taking the information we got from Schedulo and Salesforce and then manually creating invoices month after month. We've now been able to integrate the information being inputted into the Schedulo app, having it approved by the administrators, and having invoices automatically generated from that information at the end of the month. So there's no kind of mistakes being made from transferring information from one place to another. It's pretty seamless. And we're working actually with Accounting Seed on that integration in coordination with Schedulo. And we're actually planning on rolling that out this month. And with that, I'll pass it back to Marie, unless anybody has any questions.
No, Greg, thank you so much. I'm just so excited to hear this story about how, again, like I can't get over, you said a 35-year-old business achieving this level of growth at this stage. I think, not to sound corny, but speaks to the work that you've done. I mean, these are sales and operations wins, and they're really big wins, which is why we want to hear your advice on what healthcare IT leaders can do. You've told this great story. What are some actionable next steps that leaders in this space can do to have similar results?
When we first looked on this, and I forget who it was at Schedulo, but they really focused on not over-engineering. And what we found was 90% of what we do on a daily basis is repetitive. So we first tried to solve that problem. Let's try to solve what we're doing 90% of the time, and we started there. And then what we found was, after we did that, it was easier to solve those more specific problems that we're having, or business lines that weren't as busy as the other 90%. So we started there, we built it out for the 90%, and then we onboarded everything else after that. And kind of what we're seeing now is the accounting portion of it. That's kind of the last thing to onboard. What we've also noticed is that we're a small company in our marketplace, but we're probably a couple times more sophisticated than they are in terms of how we operate, which is pretty crazy considering some of the bigger providers that we're up against. With the amount of money that they have to invest in systems like this, it's just harder for them to kind of maneuver a way to figure it out. And so, when we meet with them and we talk to them, they're shocked about, how we're actually operating and how efficient we really are. And then, one of the other parts is kind of looking at, what information you want to gather, and, figuring out a way to make sure that you're able to both gather that information, but, be able to maneuver in the future for other information that you might be able to gather. Companies that work, and bill Medicare or Medicaid know that they're always looking for different types of information. And for us, one of the information that came on board quickly was payroll-based journals. So they needed to know how often our therapists were in a facility at any given time. And that using Schedulo was actually easy to do. It was a 5-minute solution that we were able to, figure out, when they started the job and where they ended the job and develop a report based on the template that they gave us. And then the last thing is, making our employees more happy. We used to have trouble competing with hospitals in retaining respiratory therapists. And, as those areas, as they became more inefficient, we became more efficient. And now what we're finding is a lot of therapists are happier working for us just because, they're able to be more productive and get their job done in an easier way without having to, comb through papers and different things like that, and communicate back with the administrators in the office.
Awesome, great. Thank you so much. We had a question come through I'd love to jump into. Hearing what you're saying about solving the 90% problem first, but 90% is like a lot of stuff. So how do you prioritize within that?
Again, the 90% is kind of just an example, but, for us, it was 90% of what we did was one basic thing. But I think, a lot of companies will find that the one major thing that they do will make up a large percentage of their operations. So start there. It doesn't have to be 90%, but that thing that, happens on a day-to-day basis that takes up the majority of your field service time, that should be the first problem that you look to solve, or the first thing that you look to automate. And you'll learn a lot from that process that will help you then do the rest. Because it's not going to, you're not going to, for us, this was, probably a 12-month process, if not more, just to get the Schedulo up and running in a way that fit our needs. You're not going to know everything in the beginning, but if you just stick to that one issue, any mistakes that you make will be easy to solve because it's not like you've kind of rolled it out with everything.
No, that makes a lot of sense. Thank you. And with that, I'm just going to really briefly we've got a few minutes left, and I want to save time for more questions. We had a few more pop through, but I'd just very quickly like to share with the group, what Schedulo has to offer to try to help businesses like NJRA and other home healthcare companies achieve these amazing results, and that is our Schedulo for Home Healthcare solution. And Schedulo for Healthcare, it's a native solution in Salesforce that schedules, manages, and optimizes your mobile caregiver teams, like the respiratory therapists and technicians at NJRA who are working on sites with patients or with your medical technology. And so it's a solution that's appropriate both for clinical and non-clinical care, as Greg had demonstrated. And the scheduling, dispatch, and workforce management capabilities are really all about extending the value of your Salesforce instance in your business. What we find frequently is that Salesforce can be an underutilized tool in home healthcare businesses, and we know this platform so well, and from working with our home healthcare customers know just how game-changing it can be for them. So that's really one of our big areas of focus is you have this system of record, and it can be doing so much more for you. So where Salesforce is holding the patient record and accounts, Schedulo is managing the profile of your mobile caregivers, the availability of your patients, and really taking a patient-centric approach to scheduling, and using that logic and intelligent optimization to determine how your caregivers are going to spend their time and see the most patients as possible and do so in a really effective way. Greg gave the example of the logic helping them to ensure that caregivers, that their therapists, weren't visiting the same facility on Mondays and Tuesdays when they could get everything that they needed to get done there on Monday. So that type of logic building into your system. And on top of that, our mobile app, which we saw earlier, is really about making it easier for caregivers to navigate to patient locations. So some good old utilization and efficiency improvements in windshield time. Having patient records and job records available to them. Greg had mentioned that one thing that happened at NJRA is that they're seeing appointments actually go a lot faster because their employees are better prepared going in, knowing what they need to get done. And completing charts and forms and capturing other critical data like photos and signatures, which Greg mentioned as well. And so our solution is really all about increasing the efficiency in your business, reducing cost of service, and making it easier to deliver that high-quality care, and as the patient understands it as well, which is having that great relationship with their caregiver, and of course, while maintaining HIPAA compliance at all times. And happy to dive in. We're getting a little close to the end here, but the scope of the solution really revolves around 3 core workflows, which is bringing in new patients and patient intake and communicating with patients about when they can expect their caregivers to arrive, managing the shifts and rosters of your caregivers in addition to their skills and availability, and understanding where they are relative to business that needs to be done so that you can optimize that process. Managing recurring schedules is an area where schedule really shines to make it super easy. As Greg said, they sometimes plan schedules up to 6 months in advance, and that's all through recurring scheduling features. And then, of course, the mobile app of helping your caregivers get where they're supposed to go, have the information that they need when they get there, make it easy for them to take notes and capture information and deliver both clinical and non-clinical care, escalate if there's a concerning development with a patient so that the care team can get notified right away, and you as a business get all the information you need to report that to other providers or to insurance companies, and keeping the care team communicating with each other in one place. So with care team messaging, you actually can we actually have chat feature within the app that not only allows people to communicate really effectively, but also saves that conversation to the patient record so that you always know, you really have that 360-degree view of how patients are being cared for. And as I mentioned, this is a solution that we developed in conjunction with New Jersey Respiratory Associates and our many other customers in the healthcare space. And with that, wrap it up really quickly. Did get one more question about if the PowerPoint slides will be available. We can certainly make these available probably on SlideShare, and a recording of the webinar will be sent to your inbox probably tomorrow. And also would encourage everybody come visit Schedule Online and learn more about how New Jersey Respiratory Associates was able to achieve these amazing results. You can see their full case study at schedule.com/healthcare, and we invite you to continue the conversation with us. Feel free to email me directly at mfrancis@schedule.com, and of course you can follow us on social as well. And Greg, thank you so much for your time today, and thank you so much for sharing your story with us.
Thank you.
All right. Everyone have a great day.